All right, Bobby, you want everybody's cameras on?
Well, I think because of the amount of people on the training, I think that I'm going to try this a little bit differently this time, and hopefully it'll run nice and smooth. What we're going to do is we're going to talk about a disability etiquette training, and what we'd like to do is have some of it is going to be interactive. So at the beginning of this training, I'm going to ask everybody if you could please grab yourself some sort of a pad of paper and a marker or a pen, because we'll be doing an activity later with that. Last week when we trained the other part of your group for the Department of Commerce, we had trouble when everybody's videos came up. So we're going to try to keep it. Normally, I like to see everybody's face because I think it's more fun. We are, however, at one point when I'm going to be asking questions and we'll stop sharing a screen, going to ask everybody to put your cameras up and unmute yourselves, and then we will hope that it'll work well. So also because of technical difficulties, Stephanie Johnston will be sharing her screen with us with our PowerPoint, and Cassie Shropshire is also going to be training with me today. We are BRCs, business relations consultants. I work in the Homewood office in Region 4, and Cassie is up in Huntsville. Cassie, I believe that's Region 7.
It's Region 1.
Oh, I'm sorry, I went the wrong way. Okay. Region 1. So Stephanie, are we able to pull up our PowerPoint? Great, thank you. So a little bit about what and how this training has come about. For years, we have been invited to employers to do an interactive training where they actually try on a disability, and that's what we call it. The disability, there we go. The disability is fun and interactive. And so at the beginning of the pandemic, when we all were shut down, one of my businesses, Regions, came to me and said, do you think we could do something like this in a virtual format? And I thought, well, sure, let's do it. So all the BRCs and I worked really hard on getting this together. It was more difficult than I thought it would be. And it's turned out to be a lot of fun because we can reach a larger audience. And we have done this training for companies that have a national footprint. So in this sense, it's really been very, very, very appropriate in getting the word out and getting our message out on how to interact with people with disabilities. So this is what it's going to be about. How do we overcome? Also, we don't want to cause any biases. We want to overcome the biases. So in this training, we're going to talk about language tips and what is a good way to speak to a person who has a disability. What's the proper terminology today? And then we're going to review some of the disabilities that Anna had already showed to you and talked to you about: blindness and visually impaired, deafness and hearing impaired, mental health disorders, neurodiversities, speech impairments, cerebral palsy, epilepsy, and mobility. So at this point, we're going to go into what are some of the language tips that are the best for us to use. So when we're talking to a person who has a disability, we want to talk about the person first. It's a person, it's an individual with a disability. So you'll hear us phrase it accordingly. Instead of saying they, grouping everybody in a group, it's an individual with a disability. He or she is a person with a disability. Instead of saying somebody is confined to a wheelchair or wheelchair bound, it's a person who uses a wheelchair. These are outdated terms, and it's okay, they change often. So if you've been using the wrong word, that's okay. It's not unusual that it would take time to learn what the proper terminology is. I've been in this job for about 10 years, and it has changed since I've been working here. So handicapped or crippled, ooh, crippled is just wrong. And we all know that one. It's a person, it's disabled, a person with that disability. Mentally retarded, not okay. Somebody with an intellectual disability. And then we also want to avoid using negative or disempowering words, not referring to somebody as a victim. It's an individual with AIDS, an individual with a hearing loss. And they're not a victim to their disability, or one who suffers from diabetes. Well, we don't know that they're suffering by any means. It's an individual with diabetes. So what we're going to do right now is the first disability that we are going to go into is about individuals who are blind or visually impaired. And we're going to show you a video that is about seeing differently. And it's going to show you a little bit about what it could feel like to have 4 different eye impairments. And so the next video, the first one, what we're going to see is glaucoma. And glaucoma is a group of eye conditions that damage the optic nerve, and the health of which that optic nerve is vital for good vision. So this damage is often caused by abnormally high pressure in your eye. And now this one is what a person might see with a cataract. And it's a clouding of a normally clear lens of your eye. For people who have cataracts, they see through that cloudy appearance. And then we have macular degeneration, which is a degenerative condition affecting the central part of the retina, the macula. And the last eye, and that is a disease of the retina caused by diabetes. And that involves damage to the tiny blood vessels in the back of the eye. So that's just a little bit of an example of what different eye impairments may visually look like. It's a pretty neat website, although I'm told the website is no longer valid. But what we're going to talk about next is how do we, okay, so we've seen what some people may look or see or talk about visually impaired or blind, but now let's talk about how do we overcome the misperceptions that we may have. So this is what we want to do as people when we approach somebody who is blind or visually impaired. When you walk up to a person, identify ourselves. Hi, Joey, this is Bobby. And then they'll know who they're talking to, right? Make introductions of others when there is a group of people. Offer to read written information. If you need to leave a person who is blind, let them know. A coworker of mine tells a funny story. He's blind, and he talks about how one day he just continued talking and the person he'd been talking to was no longer standing there. And he said, well, wow, I guess I'm just sitting here talking to myself. And he laughed about it. He thought it was funny. So we just want to be conscious of that. And it doesn't feel normal for us, or it's not a usual thing that you might be interacting with somebody who is blind. So it might feel a little bit different to us, and that's okay. It's okay to feel uncomfortable. And if the person has a guide dog, walk on the opposite side of the dog. And same with not approaching the dog, ask permission first. And same goes for the cane. And if you serve food to a person who is blind, let them know where everything is according to clock orientation, and also offer to read the menu for them. And then another part of interacting with a person who is blind and who may need a sighted guide, you want to first ask, do you need a sighted guide? Can I be your sighted guide? If they say, yes, I would like some help, then what you want to do is walk up to them and offer your elbow or the back of your arm slightly above their elbow, of the elbow, instead of grabbing the person's arm and saying, all right, come on. Kind of put your arm out and let them take a hold of it. And then lead by being one step ahead of that person. Walk at a normal pace. You don't have to walk extra slow, and give clear instructions about if they're gonna, if a chair has been pulled out, if a person is coming down a hallway in front of, coming toward you, all the potential hazards that you think might be difficult to navigate. Indicate low protruding objects, narrow passageways, objects on the ground or in the pathway. Always describe the environment using clock positions, just like you would for somebody with food on a plate. So the next disability we're going to talk about are individuals who are deaf or hard of hearing. Through the pandemic, again, this is something that's, oh, let's watch this video first. I'm sorry.
I know I'm young, could be a little bit wiser, but I've had my fair share of love, and I've seen enough of pain and hate and fire and ice to know the cold will suffice. Yes, you're surprised I'm educated. Please don't underestimate me if you cannot tolerate my opinion. For once in your life, don't if we all take one step, that's a giant leap for one little girl. But I can't do this on my own, and I don't wanna be alone. Would you take my hand and join me for tea? Some afternoon company forever. I know I'm young, could.
So that gives a little of an example of the different levels that people can hear. So what we want to do is, when the exchange of information is complex, ideally use an interpreter. That is something that you will need to be set up ahead of time as well. And when you are using an interpreter, we want to make sure that you're looking at the interpreter and looking at the person who is deaf or hard of hearing and not looking at the interpreter. And even though the person you're talking to and communicating with will be looking at their interpreter, usually they'll be somewhere to your right or your left or behind, so that they are able to watch what the interpreter is saying to them. And then we can have a better conversation. It kind of flows a little bit better. So for simple interaction, writing back and forth is okay. There is some computer technology that helps, something like Ava, Apple Notes, Live Transcribe is a good technology to use. And again, those are things that are changing rapidly. Follow the person's cue to find out what is their best way of communicating with you, whether that's gesturing, writing, speaking, could be lip reading. When we're speaking, don't obscure our face. So you don't want to sit like this when you're talking to a person, right? Because then they would have a harder time understanding. And when using an interpreter, look directly at the person, like I was saying, who is deaf. So when the pandemic happened last year, everybody was putting on face masks. And so we got with our interpreter and said to them, okay, what do you ideally think is the best way for us to communicate? And what happened at that time was, let's go to the face shield. As time went on, there's good and bad with everything. And the face shield was not great because when it came to catching the virus, it's not secure enough to stop germs. So the best way was using the clear face mask, like you see on the right. This one was a challenge because they fog, just like my glasses fog when I have a mask on. The face mask fogs. So there is a no fog spray that we can use. So in other words, there's not a great way to communicate at this point. We can put the face mask, the clear face mask and the face shield. But in the next slide, you'll see that if we have all of that on and she doesn't have the face shield on, but look at the glare on the front of her face shield. So it's hard and it's challenging, and we have to be patient, and we have to figure out what is best for the person trying to communicate with, and ask them and make sure that they maybe communicate back to me to make sure they understand and we're understanding each other. That face shield, the glare makes it really hard to see the person's face. And also when using interpreting and sign language, they touch their faces a lot, the interpreters. So it's really hard. It's just a challenge. It's been a challenge. So gratefully, we are hopefully coming to the other end of that, but still it's something to know and be conscious of. And so now Cassie Shropshire is going to start telling you a little bit about some of our other disabilities.
So individuals that have a mental health disorder, it really impacts how they feel, how they think, how their behavior is influenced, and it can also impact how they deal with people on a day-to-day basis. Mental health disorders are considered hidden disabilities because just at first glance, you can't see that somebody has anxiety or somebody's diagnosed with bipolar disorder. And stress can really affect their ability to function. So it's important that if you are in a situation with somebody that has a mental health disorder, that you keep that in mind, that you want to keep the pressure of that situation down to a minimum. As with any disability, individuals that have psychiatric disabilities, they have varying personalities and they have different ways of coping. So you want to treat everybody individually, because maybe I've been diagnosed with bipolar I got my diagnosis maybe a month ago and I'm still coping with the diagnosis and I'm not sure how to handle the symptoms that I'm experiencing. But Mary, who has a great support system, who is medicated, who is in therapy, she is handling her bipolar diagnosis very well. So again, it's very important that you don't group people that have the same diagnosis. Again, in a crisis situation, when you're dealing with somebody that has a mental health disorder, it's important to stay calm and be supportive. A lot of times as an onlooker, we want to jump in and help, but that can do more harm than good. So you want to ask that person, how can I help? How can I be of assistance to you in a mental health crisis? And you also want to find out if there's a support person for that person, if they are having or experiencing some psychosis. Is there somebody that they have that you can reach out to get advice for, or that can be sent for when that person is under distress. Next slide. So Bobby talked about earlier in this presentation, some of the outdated terms that we don't use when we're talking to or about individuals with disabilities. But it's very important that we be aware of what we're saying and what we're not saying when we're engaging with somebody with a mental health disorder. We live in a society where it's like, pull up your bootstraps and shake it off. It'll be all right. But somebody with a mental health disorder that's truly under distress and going through a lot, they don't need to hear those type of things. So saying something like stop being negative and start living, shake it. You just need to do something. And I had a trainer tell us in a leadership class that I'm in is that we should on people. Like you shouldn't tell people, what they should do. And I that always sticks with me. Why are you acting so weird? Or you have the same disorder as such and such. Again, it's very important that you don't group somebody. You don't group individuals with that same disability. Again, sometimes we see that people are struggling, but we're afraid to say anything because we don't know how they'll receive it or how they respond. But we have to get comfortable with talking to them and checking in with them. So some of the things you could say is, you seem a little on edge, or you don't seem like yourself. Do you want to talk about it? How can I help you? How can I support you through this time? And then you also have to be okay with somebody not being ready to share with you that they have a mental health disorder. We know there's a lot of stigma attached to mental health, and so people are afraid to talk about it. So, you can approach a person and say, hey, are you comfortable talking about this to me? If not, is there someone else that you can talk to? Do you have some supports in place? Do you know where you can get help from? And then also, it's okay to ask individuals if they are thinking about suicide, if they are thinking about harming themselves. A lot of people are afraid to ask that question because they believe they might, put it in that person's mind, but that's not the case. So be comfortable with asking, do you have a plan for suicide? Have you been thinking about suicide? Because asking is the first step to prevention. So moving right along to individuals with neurodiversities, and I love this picture because it is of the castmates from a show on Netflix called Love on the Spectrum. And I will do a plug for this show. If you haven't seen it, it is a really good show. It's only one season, so there's a couple, I think there's less than 10 episodes, but it follows individuals that are on the spectrum, and it's such a great show. They're all looking for love. They all vary in their strengths and their weaknesses, and it's just a good example of how successful individuals with neurodiversities can be that are on the spectrum. So check that out if you guys get an opportunity. This is a really good visual of neurodiversities, the different disabilities that fall under neurodiversity, and we're going to spend a few minutes talking about some of those. Individuals with neurodiversities, the term neurodiversity simply means brain diversity. And when we think about it, we are all neurodiverse because we all think differently. We all handle situations differently. The term neurodiverse has been around. It was coined in like 1990s, but we're now just kind of catching up and using it more frequently in conversation. So neurodiversity refers to the fact of how people learn, how they socialize with other people, how they process their emotions. Individuals with neurodiversities, they do have some co-occurrent disabilities. An individual with autism may also be diagnosed with bipolar disorder, or they may be OCD. They can have issues with executive functioning, or that could be a strength in theirs, and they're really good with organizing. Some have sensory issues as far as they can't handle certain smells, or certain optics and sound affect them. And then some have issues with their speech and language. There's some that are nonverbal. There's some individuals with neurodiversities that have that monotone voice that never changes, almost like a robot. And individuals with neurodiversities are at greater risk for experiencing trauma. So autism, we are seeing autism more and more in the workplace, and we are seeing how companies are learning to adapt so that an individual with autism can properly function in a workplace. Autism, as you know, it's a spectrum. So there's varying degrees of the disabilities. There may be issues with social interaction, communicating. Some may have those repetitive behaviors. Individuals with autism may or may not have intellectual disabilities. They may not interact typically with others. They may have social anxiety. They may need some customized support in the workplace. And so it's important that, especially if you're hiring somebody with autism, that you are patient and you're understanding to what their needs are. Small talk may be difficult for a person with autism, so you're not going to have those type of conversations. Usually the conversations will be about what I need to get done for you, and it's going to be direct and straight to the point. Again, interacting in a space that has loud music or it's crowded or lots of stimulation can be very overwhelming for a person with autism. So it's important that, you know, that you be okay, that maybe if you're doing a work holiday party, if that person turns down all those invites always, or they just never participate because it's uncomfortable for them. Environments that are not predictable or controlled can cause extreme anxiety for an individual with autism. So if a person is used to doing A, B, and C every day for their job, but you come in this morning and you say, "Hey, I need you to do this instead of your normal routine." Well, a person with autism, a lot of the times, that's going to cause anxiety for them because um, you know, having that schedule, having that routine is very important for them. So in situations like that, when you are aware that something might change, it's beneficial to go ahead and let that person know that change is coming so they can go ahead and start preparing for it and get their mind wrapped around it. Again, it's so important for patients, and allowing somebody with autism some extra time, especially like with processing information. It may take them a second to process what's been said to them before they actually respond. You know, if auditory stimulation is difficult, it's important that you can offer an alternative format for them.
So in just a second, we are going to play this video, and afterwards we will have an activity. Okay, at this point, if everybody could turn on their videos, we are going to try to see if this will work. Hello, everybody. Nice to see you. I'm such a people person. It's really hard for me to do this without seeing everybody's faces, honestly. So what we're going to do now
You're
is
choppy,
I'm going
Bobby.
to ask some questions and unmute yourself. Am I? I'm going to turn my video off, but y'all keep yours on.
That's
Does this
better.
work?
Yep.
Darn. Is that any better?
Yes.
Okay. Okay, what bus number did John and Mary get on? Who would like to answer? Somebody can unmute us. What was it?
47.
Good. Good. Okay. What color are Mary's eyes?
Blue.
Good. Where did John and Mary
Wow.
get off the bus?
What was
50
that?
yards from the supermarket.
Close. It was the name of a street.
Oh,
Was it the Trinidad Square or something?
Stevenson?
Auburn?
Somebody said Rayburn. That's the correct. I don't know who said it. How many loaves of bread did they purchase?
2.
Good. What was the total of their purchase?
$2.40.
$7.
$7.54.
Good. And what was their change?
246.
$2.47.
Okay. Now, is there anybody on here that would be willing to admit that you did not know any of those answers?
Me.
Yep. You know how I have a cheat sheet. Show you it's a lot to put my camera on. I'm gonna put it on for a second. I have a cheat sheet. I've seen this video many, many times. And still, all I hear is the noise and the sound. Am I glitchy again?
Yeah, you're a little glitchy.
It's difficult for me. All right. So now we're going to go back to, I'm glad that you all will admit that that is difficult. It's a good representation, though, of ADHD. It's one of the best I think I've ever seen. And I think ADHD, we need to be careful with it. It can be overdiagnosed. And we just need to be careful with that one, because I think all of us have a little bit of it. So next we're going to go into we're going to screen share again. And if everybody could please turn your cameras off. I wish our technology was better than it is. And we're going to go into a little bit into cognitive disabilities. And so this is another activity that we're going to put a sentence up here. I'm going to read it, and feel free, please, to unmute yourself if you know the answer to it. Okay, but I'll give it a minute so we can let people kind of look at it, and then I'll cue you when it's time to answer. So what does this say? Refrain from enumerating your infantile poultry before the proper process of incubation has been completed. So I'm going to give that a little bit of time.
Don't count your chickens
Chickens before the hatch.
There you go. Good, good. Okay, the next one. That prudent avis, which matutinally deserts the coziness of its abode, will ensnare a vermiculite creature.
The early bird catches the worm.
Wow, who was that? Who just said that? What's your name?
Lene?
Okay, did you get the other one too?
Yes.
Okay, you don't get to answer the third one then, because you're
Okay.
really good at it. I'm just kidding. But yeah, some people see it very fast and some people don't. Okay, this one, a superabundance of talent skilled in the preparation of gastronomic concoction will impair the quality of a certain potable solution made by immersing a gallinaceous bird in ebullient Adams ale. Anybody?
Something about too many cooks in the kitchen.
many-
That's all I'm thinking.
Yeah,
Yep, you guys are close.
too much cooks spoil the broth.
Never heard the end.
I knew that one too.
Did you? Yeah, too many cooks in the kitchen spoil the broth. So in our next slide, it's going to be a little bit different. This is more about a learning disability. Oh, I'm sorry. Boy, I'm just really jumping ahead today. Okay, so let's talk about individuals with cognitive disabilities first. Speak to the person in clear sentences. Use less complex wording rather than abstract wording. As you can see, those sentences that we were just practicing on, to some people it's clear, and to some people it's not clear at all. People with an intellectual disability may be anxious to please and may tell you what they think you want to hear. Be careful always with communicating, same as with sign language, same as with any situation, probably have the person repeat back to you what it is you're talking about to make sure that instructions are clear, conversation is clear. Questions should be phrased to elicit accurate information, open-ended questions maybe, or making sure that you're leading them possibly to what the correct answer could be. Be patient, allow the person to take their time, try not to finish a person's sentences. Clear signage is a great way to communicate with somebody who has a cognitive disability, or reading out loud to a person, depending, if it's somebody who's in training, reading out loud can be a great way to communicate. So in this next slide, we're going to talk about learning disabilities, and this is a sequence of symbols. And I'd like for you to tell me what comes next in the sequence. Again, if you would like to, you can unmute and let me know what you think comes next.
8.
Good.
8, 8, 8, yeah.
Yeah. Okay. So we'll go to the next slide, and you'll see the next slide shows that it's an 8, 8, and 9, 9. Now let's go back to the slide before it. How many people did not know it and now see it? Again, this is a time when I would love to have your cameras off so I could see you shaking your heads or nodding your heads. Unfortunately, we can't do that. But as you can see now, it's a mirror image of the numbers. So you've got the 1, 2, 3, right? And then 8, 8, 8, and 9, 9. All of a sudden, it's clear when you see it. I love this. This is an example of dyslexia. That is such a cool visual of what some people will see when they have dyslexia. Now, not everybody is going to see it the same way. Okay, dyslexia can show itself in different forms, but this is definitely where some people say when the letters are jumping around the page. I just love that. I think that is very effective. And then learning disabilities. Do I have somebody who might want to jump in or try to read this paragraph, please? Anybody willing? Karen McGraw, I see you're unmuted. Would you mind doing it? Sorry, I don't want to put anybody on the spot either, but I just did.
I'll do it.
Can you hear me?
Yes.
Okay. In modern society, an individual's ability to be self-sufficient is usually encouraged from childhood. By the time we are adults, we are supposed to have learned to depend upon ourselves, to be as quick on the ward as the next person, and to be ready to hold our own in a more or less, that one got me, world.
Hostile.
Hostile world.
Hostile world. Yeah, very good. Very good. You did great in that.
Yeah, I'm a little dyslexic, so that looked pretty normal to me.
Really? That's great. Thank you for sharing that with us too. No, because that I can read that pretty easily too. There are some people that maybe that word, ability in the first line would be confusing, or, modern, instead of modern society. So again, what we want to make sure is when we talk about, all right, we don't want to create a bias here. We want to overcome a bias. So in the next slide, we're going to talk about individuals with learning disabilities and how to communicate with somebody with a learning disability. Verbal explanations are key if a person is having trouble reading written information, especially in schools. If you have children who are receiving accommodations in school or in college, and maybe you yourself might have received an accommodation. There's so many different ways that we can communicate today with people who have a learning disability, for them to learn in a different way. I mean, we teach from a reading perspective in school, but a lot of people are visual learners. So there are different technologies to learn about, and that is something that our agency does. We help students, we help people in jobs. There could be a person who's working who wants to be promoted. I'm working with someone right now who she can't read. She reads at a 4th grade level. So she can't get through the trainings to be promoted. Well, we've put technology on her computer, so that now the training is read out loud to her. I mean, imagine, she is so incredibly smart and she memorizes everything because she can't read. She has self-accommodated for years. She's too embarrassed, too afraid to let anybody know she has the disability. She's not embarrassed anymore. Now she sees, well, just because she learns differently doesn't make her any less intelligent. So when a person's, when spoken information gets scrambled, write it down or demonstrate it. Ask the person how you can best relay information to them. That's key with everything that we're talking about today. Be direct in your communication, and the person may need to function in a quiet environment without distractions. And that goes with learning disabilities, with ADHD, with cognitive disabilities. That is something that is pretty common. So what we're going to do next, I asked everybody to have your piece of paper. Okay, I'm going to try to share again. I'm sorry that this is working like this, but we're going to stop screen sharing again. And if everybody can make their cameras active, I'm going to demonstrate to you. If you could grab that piece of paper that I asked you to have in the beginning, I can see myself laughing, and take the marker. If you're daring, you'll have a marker. If you don't want to get any marker on your forehead, then you might want to use a pen. But we can all read it much better if you use a marker. With your dominant hand, please hold the pad of paper, and you're going to put it up to your forehead. And then with the marker, with your non-dominant hand, I'd like for you to write your name across the paper so that when you bring the paper down, you read your name correctly. Okay? This is a simulation for traumatic brain injury. So here we go. You can unmute yourself too. It's kind of funny. So I'm going to write my name. I've gotten to practice a lot, and Bobby is kind of easy to write because of all the B's. Okay, maybe write what? Now let's see. Can everyone unmute? Steph, can you unmute everyone? So yeah, with your non-dominant hand, hold the pen. Did I say dominant, Cassie? There you go.
No, you're
So
good.
let's see. So, Dietrich, when you look down at your, there we go. Let's see, is that hot? I'm going to turn my video off if I have to. Okay. Let's see, Dennis, let's see yours. If you hold yours up a little bit more, we can see yours. Deb, you did a job. All right, so you can see also with this, in this activity, it's interesting, when we do it on the computer, you can see that when there's a different, when you look at it in the computer, in the screen, and you show each other it looks different than when you would put it down to read it yourself. So again, that's our brain, and the camera can flip it another direction. So it's very interesting. So, traumatic brain injuries. Someone on the camera does have a TBI, which is nice. Not that you have, I don't mean it like that, but thank you for your disclosure. And some people, again, this is one of those disabilities that we don't want to categorize anybody, because people with a traumatic brain injury. So what we're going to do is we're going to go back to screen sharing again. So if you wouldn't mind hiding your camera again, that would be great. So here, individuals with traumatic brain injury, may have a disability that is not obvious. It's an invisible disability. We have those whole categories of invisible versus visible. So may have poor social skills. I don't love that one, because that is something that is subjective. may be unable to follow directions due to poor short-term memory, which can be, may have trouble concentrating or organizing thoughts, may not realize that they have a disability. I do have folks that I work with who have a traumatic brain injury, and I'm sorry, we'll need to mute.
Point before 1:30, could you send me over
Stephanie,
the kitchens program?
Somebody on the ALDT needs to mute.
Yeah, it's when they get her to.
Okay. So yeah, so individuals with traumatic brain injuries, we don't want to categorize, but we do want, and it's great when you do know that you have somebody that you're working with that does have a traumatic brain injury. And you will again ask them what is the best way to communicate with them.
So individuals with speech impairments, so I'm going to say a couple of sentences and I want to see if you guys can understand what I'm saying. Good morning, my name is Cassie Trasher. Did anybody get that?
Oh, but just the last little bit.
Not really, Cassie.
I got the beginning.
Yeah.
So what did you guys hear?
Hello, my name is Cassie.
Yeah, I got, hello, my name is Cassie Strasseer, and after that, I couldn't.
Okay, so what I
For
said.
the Department of, go ahead.
Yeah, so what I said was, my name is Cassie Shropshire. I work for the Alabama Department of Rehab Services as a business relations consultant. So seeing that or hearing that, you see how difficult it can be to communicate with somebody that does have a speech impairment. So when you are interacting with somebody with a speech impairment, you want to make sure that you don't interrupt or try to finish that person's sentences. Again, patience is key. If you're having trouble understanding them, just don't nod as if you agree and you understand. Ask them to repeat what they're saying. And then if you still can't understand after they repeated it, ask them to write it down, or, even make the suggestion of, is there a better way to facilitate communication? So maybe texting or chat, whatever, whatever would be easier for you to understand. Also, like with the other disabilities that requires a little bit more focus, being in a quieter environment is very effective when you're communicating with somebody with a speech impairment. And then again, don't tease or laugh. I always, I'm always iffy about that, but I've been in some situations where there was an individual with a stutter, and a lot of times people laugh at that. So we want to be mindful of that. Individuals with cerebral palsy. So if I am like a Netflix queen, so there is a show on Netflix and it's called Special, and the main character has cerebral palsy, and it's such a good show because this individual is working, and when he goes to work, he doesn't disclose that he has cerebral palsy. He shares that he was hit by a car, and that's why he walks the way he walks, and later on he does disclose. But it's a really good show about disability in the workplace and socializing, and individuals with a disability just living normal lives. So again, that was my Netflix plug. I've given you a couple of things to watch now. But for individuals with cerebral palsy, you do want to follow those tips for speech impairments because a lot of times they will have some issues with speech and communication. You want to monitor your responses and interactions with that person as you will with anyone else. Get the facts before acting on first impressions. We've seen in the news several times where, you know, individuals with cerebral palsy have been pulled over, and it was assumed because of their speech and their demeanor that they were actually drunk driving, and that was not the case. But you don't want to make the assumption about their cognitive ability based off of their speech and mobility, because individuals a lot of times that do have cerebral palsy do not have an intellectual disability. Individuals with epilepsy, also known as seizure disorder, there is absolutely nothing that can be done to stop a seizure. Again, it's a situation where a lot of times we want to jump in to help, but there is nothing that we can do. We have to allow that seizure to run its course. If the person has fallen, you want to make sure that their head is protected. Again, you have to wait until the end of the seizure to do anything. Ask that person if they need medical attention. A lot of times if an individual has epilepsy, they have a seizure, it ends and they can resume back to life as normal, and they don't require medical attention. So again, just being that onlooker, that helper, a lot of times we just want to jump in and we call for medical help, and it's not necessarily needed. So again, make sure that you're asking how you can help instead of just jumping in certain situations that way. When the seizure has ended, you want to make sure that that person has privacy, because a lot of times they do feel embarrassed or they are disoriented. So again, making sure that they have a place where they can just kind of get themselves refocused and back to what they were doing. And then the last disability that we're going to talk about is individuals who are in wheelchairs or have mobility issues. When you're interacting with a person that is in a wheelchair or have a mobility impairment, you want to make sure that you're not leaning over on that person's wheelchair. You know, it is their personal space, so you don't want to get too casual and comfortable and just start leaning over. You don't want to push or touch that person's wheelchair without permission. As with everything with helping or dealing with somebody with a disability, you want to ask, you know, before you do anything. If an individual with a disability is coming in for an interview or they're starting employment with your business, you want to make sure that all your ramps and your wheelchair accessible doors to the buildings are unblocked and they're unlocked so they can have easy access to get into your building. When talking to a person in a wheelchair, you want to make sure that you're sitting on their level, at their eye level, so you can have a conversation. Be sure that you have signs up in your facility that show a person, you know, where the elevator is if they need to go to another floor. And then last but not least, and we all know this, is don't ask a person in a wheelchair to hold things for you. And there's a cute little video that I've seen where there was an individual in a wheelchair in a mall, and they were shopping with a friend, and the friend was buying all this stuff, and then she was just kind of throwing all of it to her friend in the wheelchair to hold. So these are just some things that we would like for you to be mindful of when you are interacting with individuals with disability. Bobby has said, you know, we don't want to create biases, we want to overcome them. So we hope that some of the things that we've shared today, you'll keep in mind when you are interacting with individuals with disabilities. And so the last thing we're going to do is we're going to show this cute little video about how to interact and some do's and don'ts of engagement with individuals with disabilities.
Good morning, Mom.
Morning there.
Hey, man.
Morning, Alice.
There's no need to be awkward.
Poor Bob. Like so many of us, he just doesn't know how to interact with people with disabilities.
It's pretty easy, really. People with disabilities are people first.
We need the same things that every person needs, like respect.
Good morning, everyone.
Attention! Okay. Maybe we need to be more specific.
The easiest way to show respect is to focus on the person, not the disability. It's okay. You'll get the hang of it.
One easy way to focus on the person is to watch the person signing and not their interpreter.
Or their companion.
It's really cool that you'd like to help, but do us both a favor and please ask me first. What you think might be helping?
I got you.
Wait, ah! Oh no, might actually not.
If you'd like to offer me help, let me hold on to your elbow. Don't take mine.
Hey, would you like to take my arm?
Sure.
Assistive devices help us to live our lives. They're really important and really personal.
Grabbing them only makes it weird for everyone.
What? Please only touch our devices and service animals if we've given you permission. And don't take it personally if I ask you not to. Remember that my service animal helps me all the time. Neither of us would like it if we were separated.
Remember, we make our own decisions. We sign documents, vote, volunteer, work, and pay taxes.
We get married.
So don't underestimate me just because I have a great smile.
Just because I'm blind does not mean I'm deaf.
No, I think he said he was going to come.
Just because I'm deaf doesn't mean I'm blind.
And just because I use a wheelchair doesn't mean that I can't sweep you off your feet.
So take a deep breath. Relax. We don't bite.
Unless we're really hungry.
Hello there, ladies. How are you?
Hello. And if you're not sure what to do, just ask.
Hi, would you still like to see a menu?
No thanks, but can you please read it to me?
Sure, definitely.
Just treat us the way you would want to be treated, and we'll all be okay.
Good morning.
Good morning.
Morning, Alice.
Morning.
Awkward no more. Nice job, Bob. Go forth and be human.
There's no need to be awkward.
We just love that video. It's very effective. So in conclusion, always ask before you help. Be sensitive about physical contact. Think before you speak. Respond graciously to requests. Don't make assumptions. And don't take things too seriously. And what we're going to do now is we're going to turn it back to Anna. And so if anybody has questions, we will do a question and answer after Anna's short training right now.